Assalamu alaikum. Welcome to Tuesdays with Dr. T. So yesterday I spoke with two mom who wanted to join our group, and then I had some really interesting realization of what is actually going on in our community in the name of autism recovery or support. So based on their experience today, I'm gonna teach you and give you my own strategies on how to choose the perfect coach or healthcare professional for your child's autism recovery or brain development, support. So let's start with the stories. Number one. So the first mom that I spoke she was from India, and then she was going through a lot of biomedical treatments. And then she was also part of a pretty large group of parents working through all of those treatments, right? And then she said that, what's happening is lots of kids were actually getting even sicker with the biomedical treatments, with the chelation therapy, with the heavy metal detox that the naturopaths or the doctor, the healthcare professionals there were providing, okay? And then I was like, my God, this is really becoming, first of all, autism itself is becoming like a pandemic. It's an epidemic level. And then if our healthcare system is just, there are some big part of our healthcare system does not really care about autism. They slap on the tag and then they say that there is nothing much you can do about it and you have to pretty much live with it. And then what happens is there is a few segment of the community where people are getting certification and people are getting understanding of how to do the detox and change the diet, and all of those things are really great. But what I don't like, and because of their shortcoming, all of these thousands of kids who are young and who could have actually reached so much potential, they are getting sick and they are being hospitalized. Can you imagine that? So when you are choosing a biomedical or a protocol, the first thing that you need to think about is the safety, right? So if you want the strategies, please hold on a few minutes before I lay out the context of the whole video here today. So I'll give you the tips and strategies on how to pinpoint and find a protocol or a program or a doctor or somebody that you can really rely on, okay, for your kids' autism recovery or brain development needs. So the second mom that I spoke to, she was telling me that she went to this naturopath doctor and then a naturopathic practitioner, and then she was given this detox protocol and then called it a day. The doctor told her, like, okay, here's the thing that you have to do, and then call me back after 6 months. So the mom was trying to feed one of the supplement from the protocol, and then the child was not taking it. So what the mom did was she emailed I'm so sorry, expression issues, it seems. I'm always coughing. Okay, so what she did was she emailed the naturopath that I cannot feed my child because he's a picky eater. He's a severe picky eater and he has a lot of food aversion and texture scare, like feeling of problems and things like that. So how can I feed him when I cannot, how am I going to do the detox? How am I going to change the diet if the child is not taking the detox, right? And there was no answer from the naturopath. Nada, crickets. There was no answer from the coach, from the naturopath that she went. So she was like, when I am trying to, because most of our autistic kids, they have some form of severity of sensory issues. They have gut imbalance, they have food sensitivity, food intolerance, sensory issues regarding to food texture and taste and things like that. So you cannot just give a system to a person and not teach them how to be able to implement that system, right? That is why those naturopaths are not making they don't have like a full-fledged system or program. And that is the number one reason why we inside the Autism Success Academy always talk about full program, Because if you go somewhere which is cheaper, yes, a naturopath doctor takes somewhere between 500 to 600 US dollars or Canadian per session, and then she will make a detox protocol for you, and then maybe you will go to another dietitian to get the diet protocol. Yes, you can make it cheaper, like within 1000 to 1500 bucks you can get the diet and detox protocol. But here's the thing, will you be able to implement those things for your child? That's the question. That's the $1 million question. Okay, so here are my takes, my thoughts about the things that you have to keep in your mind before you choose a practitioner or a doctor or a healthcare professional or even a coach to work with. Okay, the number one point is, does your autism coach or recovery coach or brain development coach have real degrees, or are they just certified? So here's the thing, certification are short term, 3-month, 2-month, or even 6-month courses that pretty much anybody can join and get certified in. You don't have to have a background, like an educational background specific for that. So for example, I see in Instagram some of my peers, they're just they're not healthcare professional per se, because they did not get a doctor, MBBS or a pharmacist degree or even a nursing degree. They might be just what's the thing called, like technician. Yeah, they're just technician. But then since they're technician inside, they worked inside a medical structure or a clinical setting, now they get to call themselves healthcare professional. Are you being cheated by those kind of people? Are you being told that, I'm a healthcare professional? On the other hand, they're actually not. They're just some technician who were going through some, machines, I would say. Okay. Another thing is, when you are seeing detox specialist, please remember, it's very easy to get a detox specialist certification online. You don't have to, because I did it out of interest of learning, like what these people are saying that they are detox specialists. I would like to get that certification as well and see what they're actually learning there. Is it very much different from pharmacy and whatnot? So I was like, wow, interesting. You can finish the degree it's not a degree, it's a certification. You can finish the certification in like 2 months and pay like 500 or 600 Canadian. That's it. So a certification that you can get in 2 months without a background in real healthcare education, those are the kind of people you are thinking that they are specialists, and then you are going. And because they're not really specialists, they're not in depthly knowing and learning about anatomy, physiology, pharmacology, how the brain works, how the body works, how biochemistry works, how gut works, then what happens is their knowledge, their shallow knowledge, is going to be bolstered by lots of supplements. That is the reason of overuse of supplements, because these people, they have shallow knowledge. They don't have the deeper knowledge of what is happening inside your child's body. So because they have shallow knowledge, they just know a little bit of celery juice and a little bit of this juice and that juice. Yeah. So now they have to bolster, they have to strengthen that claim based on supplements. Here's the thing. Somebody who has a real degree, yes, a lot of the doctors these days also do not care about autistic kids. I get it. They have learned their books, which were 10, 20, 50 years older version. They are not yet learning things that are now being discovered and in research, because it takes about 15 years for our published research to get inside a textbook of pharmacy or doctorship, okay, as in MBBS. So you do understand that the latest research needs to be incorporated, and it will take a lot of time. So by the time your pediatrician is telling you that yes, gut healing can really help your child's brain to develop, I bet your child will be 20 years old. Okay. So the number one thing that I was saying is, does your coach, does your coach have a real degree in healthcare versus does they have just some certification? Okay. The second thing, the second important thing is, does she or he have real life experience working with autism kids on their own? Here's the thing. A difference between a doctor and me was this. Let's say just a pharmacist, okay? A different, because I'm a pharmacist with a PhD. So let's say a pharmacist with a PhD and another pharmacist with a PhD. I have autism kid. I worked with my son, and that person does not have autistic kid, or they did not work with their child. So they giving you a protocol will be very much different than me giving you a protocol. Why? Because I have freaking worked on my own child. Yeah. The first experience that I gathered was personal experience, going through and learning and really hunkering down and going through the phases of brain development with my child. Yeah. So when you are choosing a healthcare professional or somebody that you want to work with for your child's brain development, make sure that that person has real life experience. Okay. And a spin-off of this point, the third point is, make sure that that coach reached their, like how long did that coach took, or how long did it take for that coach to reach the success that you are dreaming for your child. So for example, is it taking 5 years? Is it taking 10 years for somebody to get their child to speak? Or is it taking 2 years, 1 year for somebody to have had, alhamdulillah, God gives results, nobody else. No human being can get results if God does not permit that. So obviously that's the number one issue. But what I'm saying is, if a coach has had needed like 10 years to reach the success that you are seeking for your child versus somebody who took like 1 or 2 years, you can understand where you should go, right? Because I think you don't have the patience, or you don't need to wait 10 years to see your child having a regular, normal life and a regular way of having independence in the life, right? All right. The fourth most important point to keep in your mind before you choose a program or protocol or a practitioner is how safe the protocol is and how effective the protocol is. Okay, not all protocols are same. There are lots of very well-renowned protocols in the internet, in the world, which are just very surface level. You give one little bit of this supplement, maybe inulin, then you change a little bit of olive oil. If you know who I'm talking about, which protocol I'm talking about. Yeah. So, or maybe you are taught that, put the water for your child in the sun, that will charge the water. Yes, sun charges water, but that's a very tiny, shallow level support your child needs. Even a lots of people, I have this question every single day. Somebody will ask me, or a few hundred will ask me, and that is this, PBX, zeolite, this kind of thing. So share a screenshot in the video right now in the screen, so you can see the type of detox that I'm talking about. Those are shallow level. Those does not work really well because they are, how to say, subcategory of quality. Okay, I will make a separate video inshallah next week about going through some hot shot, what is the thing called, products that you guys really want to try or have tried and failed and really want to, for those things to work. Here's the thing. We want, let's say we got this $20 thing or $50 thing off internet, and we really want that thing to work. Because why? Because it's cheap. If it works, then I don't have to do anything else, right? But very rarely cheap products give you good results. Yeah, you have to have quality. So like I was saying, how fast and how safe is the protocol, is the detox or the diet changes or the lifestyle, whatever change that you want to do and your child needs. Make sure that those changes and programs and protocols are very safe. They are chemical free. They do not increase the toxic exposure of your child's already sensitive system. And they are made of herbs. They are made from nature. They are slow enough that it does not cause harm to the body, but also fast enough that you get results within 1 to 2 years. Yeah. And the last thing, that the fifth point that you need to keep in your mind before you choose a program or protocol, is the level of support and accountability. Spinning off from the mothers that I was talking about yesterday. So like the second mom that she was saying, that she wanted the support. She wanted, because she asked the doctor, like, what if, how am I going to feed my child? He's severe picky eater. The practitioner right away told her, it's not my problem. You have to figure out how to overcome picky eating. My job is to give you the program, the protocol, the detox protocol or the diet protocol. It's all up to you how you feed your child. Yeah. And then I know from experience, because I have been there, I have done that, and alhamdulillah, more than 160 students have been under our belt, and they are working with us, past, present. And every single mom, based on whatever financial categories they have, they need support, they need answers. At least they need somebody to tell them, yes, maybe you are not you don't have the abilities to join our full programs, YLD or 6MD. But even if you are a mini course student, our mini course is just a $37, very small course. But I still give that person one coaching call. At least with $37 that you are spending with us, you are learning the 5 most important supplements, and you are also getting understanding of what food to feed, what diet should be there, and you are understanding the 5 pillars of the brain development system, and you are also getting one coaching class, full-blown coaching class with me and my coach. So that is the level of support you need every step of the way. Because every day there will be a new challenge. Every day there will be something new. And the thing that the best way that I can describe is this. So talking about these 5 points, what I do is, first of all, I have a PhD. The number 1 point, that real degree versus healthcare and certification. So I have a PhD in pharmacy, specifically in natural medicine. That means the detox part, the body part, the how brain develops, the how body works, how your supplements are causing problem, how your medical pills and medications are causing problems and side effects. I know all of those things. Okay. It took me, alhamdulillah, less than 2 years for my child to speak very fluently. He was totally nonverbal, no eye contact, severe head banging, severe struggling, okay? No expression. He would not able to show his joy or upsetness based on context. And then he was, angry and agitated as well. So it took us about 2 years to go from that to, how to say, you can say recovery. Yeah, like that. So the third thing is real life experience. Yes, I was working with my son first. Before that, I did not know anything about autism. I was on the spectrum. I knew about ADHD because I have ADHD. So I was on the spectrum. So I know that ADHD is there, and that, this thing is there, but I did not have any idea about autism. So working through with my son was the first experience that I had. And then I was fully dedicated to making sure that the best support that I can give to my son so that he can lead a healthy, happy, independent, understanding life. That was my experience. The fourth thing is how fast or safe to get result, right? So what we do is, I do not use any chelation therapy. I do not use any chemicals. We use only 4 supplements, but they're not actually supplements. They are from nature, food and vegetable based natural products that is helping with the detox. You don't have to do celery juicing and all of those crazy juicing things with me. No, you don't have to do that. Those are for others, okay? So the detox that we use, they are very safe because they are 100% natural. And then that detox thingy is just one thing. I use one enema which is nature based, okay, fully natural, nature based. And then we use fish oil and probiotic. Everybody these days uses a fish oil and probiotic for their child, right? That's it. That's the core thing that we do. And with that simple, very simple 4 thing, then comes with a lot of support, with a lot of layers. How does your child wake up? What do you do after he wake up? How do you brush his teeth? Which paste do you use? What type of breakfast are you feeding? How are you overcoming his picky eating? How are you making sure that your child is ready for the day? What sort of tiffins are you packing? How are you bathing your child? How are you making sure that he's sleeping, he's eating, he's playing outdoors? All of those things are taught to you by me and my coaches, because I know that child development is not just slapping on some biomedical procedures on your child or changing a little bit of diet and calling it a day. No, it's not like that. It can be simple. You have to do it consistently, but it also has to be safer, and it also has to be backed by science. So anything that we do is also research based, okay? It's not woo-woo or coming out of nowhere. And they are 100% safe, alhamdulillah. 100% working, alhamdulillah. And those are the things that you need to work on. So yes, at the end I was talking about me and and how we work. And please do not take it like a like advertisement. The reason why I shared is most of you guys who are following me in Facebook or YouTube or Instagram, you guys want support from me. So if I don't share how I really work, how I am different, and even if you cannot work with me, at least with these 5 points, you now know what you should look for when you go to another coach, when you go to another program, when you go to another healthcare professional, okay? Because ultimately at the end of the day, the most important thing that I work for is your child's independence and success. I am crazy obsessed with autism success. Crazy autism success, okay? Which is why anything that we do is full of support, full of accountability, full of safety, full of gentleness, yet effectiveness and results. So let me know in the comments if this video was good for you. Subscribe also and share, because you need to share this video. Lots of other parents are going through these biomedical things, and they're actually causing more harm to the child. They're scared to go to the doctor and then tell them that they have tried this thing and failed, because nobody wants to be blamed or shamed or made to feel guilty. The autism parent already is feeling guilty because she or he is already feeling like they have failed their child. You do not need any more guilt or shame or blame on your shoulders. You did the best that you could, but after this video, if you are doing anything like that, please stop. Do your research and find the best person to work with, okay? If you want to work with us, I'm leaving the details in the screen and you can contact us and talk to us. And I am thinking of bringing back our once in a year annual 3-month short course which we call summer school. You will know the details also. Please subscribe to my email newsletter so that when I'm ready to offer, you are the first one to know that the offer is up, because this summer school is gonna work on the diet and the detox part of your child. It's a shorter program so that you can invest very comfortably. You don't have to go anywhere. You don't have to do any other tests. You just stay at home, enjoy your summer with your child, and also make sure that he is school ready by the time September comes around. So I hope this was a really nice chat with you guys. I'll see you in the next one. It was a little bigger video, but I had to say what I had to say. Okay, see you in the next one.